world of research, it constantly changes for me because knowledge moves on. But what the campaign is offering the university is the ability to accelerate what we believe are the key challenges that face us. I have the responsibility at the moment of leading the Faculty of Medicine and Health, which is about a quarter of the University of Leeds. We train all sorts of health professionals, but more importantly, we're engaged in colossal amounts of research.
So we've been working on active lives and joint replacements for hip and knee joints for over 20 years. In the future, instead of getting a metal and a plastic knee joint, you will get a biological scaffold which repairs itself.
Leeds Teaching Hospital is one of the largest hospital complexes in Europe, and we aim to be a research-intensive organisation. And the reason for that is that research, clinical research, is good for our patients.
We talk about research being from lab to bedside, but in fact it's also from bedside back to lab. Right? So it's that interaction between the scientist and the clinicians.
As an organisation, we measure our success in terms of two key things. Firstly, the outstanding research that is carried out by my academic colleagues, and the second thing by which we measure our success is the outstanding graduates that we produce.
I'm researching Alzheimer's disease, which is the most common form of dementia in the world. It affects 1 in 3 people over 85. Scientists are detectives. They're doing things that nobody else in the world has done before.
It's good that our undergraduate students actually understand what they can go on to achieve personally. So we'd like to share with them the story of our alumni and where they've got to in the world.
Well, I've been involved pro bono things for a long time, chairman of Opera North, Philharmonic Society, and I've always felt a debt of obligation. I've been very lucky, and I've always wanted to give something back. It sounds awfully cheesy, but it's the truth.
The biggest thing is about having brains. It's having those academically brilliant people who are here, who come in and say, can see something that perhaps seems a little off the wall to begin with, but in the end is the lead that you require.
The donor contributions will help us employ and support more researchers, more young people who will then go on in their careers to work in industry, to work in hospitals, and to deliver this technology out to patients.
So this campaign is all about legacy. It's legacy in terms of the research that we will be doing to translate the lives of people, patients in hospitals such as this one in Leeds, but also in healthcare communities around the world.
I just say give generously and go that extra mile, go beyond the point where you normally go, because it will be well worthwhile. You'll get a great feeling of satisfaction, and that's what it's about in my view. It's helping others.